What is the history of hypertension? Symptom discovery. Imagine trying to understand a silent condition that can quietly damage your heart and arteries without obvious signs. That's been the challenge with hypertension or high blood pressure over centuries. Long ago, ancient Chinese doctors around 2600 BCE observed that eating too much salt could make the pulse harder, hinting at vascular changes. Egyptian texts from thousands of years ago also described the pulse's link to heart and brain issues, but they lacked tools to measure blood pressure precisely. It wasn't until the 1600s that science made a big leap. William Harvey explained how the heart pumps blood through the body, giving us a foundation to understand blood flow and pressure. Then, in 1733, Reverend Stephen Hales measured blood pressure by inserting a tube into a horse's artery, showing that blood pressure could be quantified. The real breakthrough came in the late 1800s and early 1900s. In 1896, Scipione Ravaruxa invented the mercury sphygmomanometer, a cuff device that made measuring blood pressure easier and non-invasive. Just a few years later, in 1905, Nikolai Korotkov described the sounds heard when releasing cuff pressure, allowing doctors to tell the difference between systolic and diastolic blood pressure. These innovations turned hypertension from a vague idea into a measurable condition. By the early 20th century, data from insurance companies showed that higher blood pressure was linked to increased risk of death from heart disease. The term malignant hypertension appeared in 1928 to describe severe cases with dangerous symptoms. Initially, many doctors believed high blood pressure was inevitable or untreatable. But in the 1960s, research proved lowering blood pressure could reduce complications and save lives. This shifted hypertension from an unavoidable problem to a manageable chronic condition. Understanding this history is especially important for Black communities, where hypertension often starts earlier and hits harder. Historically, lack of culturally sensitive health care and preventive care worsened these disparities. Today, recognizing how symptoms and measurements developed helps us create better, more tailored ways to manage hypertension. Promoting early blood pressure screening in Black communities, educating about symptoms and risks, and offering culturally relevant nutrition and fitness options are all ways to improve health outcomes. Mental health support is also key, as stress can worsen blood pressure. By knowing how we discovered hypertension symptoms, we see the importance of combining medical progress with culturally competent care. This approach can help reduce the health gaps and support healthier lives for everyone.